Here we go. Okay, welcome everyone, and thanks for joining us here tonight on Choices Market's YouTube channel. I'm Darcy Furness. I'm the nutrition consultant here in the South Surrey location, and I'm happy to say that we're now able to resume our free nutrition consultations with COVID protocols, of course. So if you'd like to take advantage of the services that we offer, reach out to your nearest Choices Markets if you're not in my store location, and you can find out when your nutritionist is working, and you can take advantage of these services. So tonight we're going to be talking about gentle movement and relaxation. And I've got a couple of housekeeping things to start off with first. So a great way to stay in touch with all things healthy is to go to our website, www.choicesmarkets.com, and sign up to receive our newsletter and our flyers. And that way you can find out about our sales coming up, also upcoming events, and lots of health and nutrition articles in that newsletter. And to thank you for your participation tonight, we're going to be sending you this coupon, which is a nutrition coupon, or a nut buck as we like to call it. And that's good for $10 off a $50 purchase. And you can put that towards anything in our store. Dr. Sandhu also has a lovely gift for you tonight to thank you for participating. And that's going to be a complimentary pain assessment, which is valued at $100. So I'll be putting some notes into the chat to let you know how you can access that offer. And you'll also be receiving an email tonight about 8:30 that has, we're going to ask for your full mailing address, and we're going to mail you this nutrition coupon within about 2 to 3 weeks. We're also going to ask you to complete a short survey. And you'll also have the email address for the Solage Clinic in that document, and you'll be able to reach out yourself directly. Just a note about questions tonight. If you want to ask questions, you'll need to be on your own YouTube account and signed in to use the chat function. So don't worry if you don't. Most of the questions hopefully will be answered, and if they're not, you can reach out directly to the clinic and they will follow up with any questions that you have. Okay, so tonight I am delighted to introduce Silak Domingo and Dr. Jag Sandhu. Dr. Sandhu brings over 20 years of experience as a sports kinesiologist and chiropractor and is the owner of Solage Laser and Physiotherapy Clinic here in South Surrey, right beside our store. He specializes in bone and joint pain, whiplash injuries, rehabilitation of sports injuries, and mind-body protocols. Silak Domingo is a fourth-year kinesiology student at UBC and plans to pursue a career as an occupational therapist. She works with Dr. Sandhu as a rehabilitation assistant, and she'll be leading us through some of the exercises tonight. I can personally vouch for Solage. Visiting my daughter in Winnipeg in 2019, I had a silly accident and I dislocated my shoulder. And the very competent team at Solage fixed me up using a variety of modalities, and they just did a great job. And I have full mobility, so I can really vouch for the work they do. So please join me tonight in welcoming Silak Domingo and Dr. Sandhu as they lead us through gentle movement and relaxation.
Welcome, everyone. My name is Dr. Jag Sandhu. I'm a certified kinesiologist and chiropractor. I'm master certified in cold laser therapy, and I'm a Pain BC practitioner, certified Pain BC practitioner as well. As Darcy indicated, we're a partner, collaborator with Choices. We're right next door to Choices out here in South Surrey. We provide the most advanced and highly personalized laser therapy treatment in BC. We're known as a laser clinic first. However, we have an integrated team of providers, including physiotherapy, chiropractic, kinesiology and active rehab, acupuncture and Chinese traditional medicine, registered massage therapy, registered clinical counseling, and we also offer custom orthotics and bracing here in Solage. And if you have extended health, we'll direct bill any insurance that offers direct billing. Normally in a workshop like we've done with choices in the past, we ask for input on why folks are attending. And unfortunately, before the our debrief with Darcy, she mentioned it doesn't really work in the virtual world. So we're going to make some assumptions that some of you are coming for, chronic pain conditions. Some of you are coming for just to get, moving out of your chair. There's a lot of Zoom meetings going on, and you want to just try something new. Some of you, it's happy hour, right? You're joining with your friends and you're having a glass of wine. That's all okay as well. Obviously, in a setting like this, everyone has their personal needs, their personal concerns. We can't really address everything, but we wanted to offer a few resources and tools that you could use at home. And I'm going to just try sharing my screen. One is if you go to our website, slage.ca, you can search up either if you have a current condition like osteoarthritis, you can go into osteoarthritis in your hand or wrist and learn more about it and see if there's something that, you can look at treatment options and how we apply laser to help different osteoarthritis conditions. And if you don't know what your condition is and you have a problem, you can go to our pain finder. And so if you have some neck pain and you're trying to sort out what the issue is, you can go into here and you see, look at common symptoms, common conditions. You can read about, different types of headaches. So there's lots of resources there for you as well. And the other, I guess the next step, if you're not able to self-diagnose or Dr. Google it, we're also offering a complimentary pain assessment valued at $100. So if you go into Book Now, you go to our booking page, you see all our therapists here, and you go to the chiropractic section. Anyone attending tonight or viewing this webinar can access a complimentary pain assessment, but you have to have viewed this webinar to receive this offer. The next thing I'm going to talk about is something. If there's one thing you learned today, I want you to remember this diagram, and it's the tissue tolerance and tissue damage diagram. So before you have an injury, or it says pre-injury, but it should say normal, what normal is. So normal tissue tolerance, it increases, and alarm bells ring at the appropriate time to warn you, like, don't do this activity, you're lifting too much, or you're doing too much activity, and you start to get, the sensation of pains that, your body's trying to warn you, don't go beyond this point. What happens if you go beyond that point? You sprain your ankle, you tear a muscle. That's what happens when an injury happens. So once you have an injury and chronic pain cycle develops, what happens to that alarm bell is it gets lowered. So you see here, there's the tissue damage tolerance is a lot lower. So what we're going to be doing today, what I want you to focus on when you're in your gentle movement exercises, is try to push yourself just up to that bell, no further, just up to that bell. If you go past the bell, then it might result in a flare-up. And generally, I say if you're sore or flared up for more than 24 hours, you probably did too much. So like I said, if there's one thing you remember from today, I'd really like you to remember this chart. And as you're going through the exercises today, just go up to the alarm bell. And there's another diagram I'm going to show you just to explain it a little bit more. Yeah, so this is the same sort of illustration. So it talks about pacing and grading exposure. Go to the level of soreness, the safe line today. So if you're having any type of chronic pain or issues, I only want you to go to the safe line. If you go past that, or through it, then it could result in a flare-up. So that's something I want you to remember today. Psylocke is, she's been working with us for over 8 months. She's just got promoted and is going to be extending another co-op term with us. So you're in good hands, and she's going to walk you through our gentle movement program today. Thank you.
Okay, awesome. Thank you, Dr. Sandhu, for all that information. And thank you, Darcy, for introducing us. And I'm just gonna put everyone back here. Just a moment, folks. Just getting prepared. All right, now that Dr. Sandhu is 10 feet away, I'm gonna take this off. And today we're gonna be doing chair yoga. We're gonna be doing a gentle movement class. So if you ever feel that an exercise may be too difficult for you, or if you do reach that alarm bell and you do feel any pain, you're just gonna come to this resting position and you're just gonna close your eyes and you're gonna take deep breaths in through your nose and out through your mouth. So you're just gonna stop right here and you're gonna do that until you are comfortable enough to join us. And sorry, I'm just going to minimize this so then I can see what time it is. Thank you. Now, since we're ready, let's begin. So we're gonna start off with a simple chair twist. So we're gonna find our right side and we're just going to turn slowly. Just like this, we're gonna grab the side of the chair that you have next to you, and we're just gonna take some deep breaths. We're gonna be here for 5 breaths. So inhale through your nose, exhale through your mouth. 4, 3, 2, 1. And now we're gonna come back to center, and we're gonna reach to the left side now. And we're gonna look away or out where our shoulder is. And we can just rest here, close your eyes. And we're gonna be here for 5 breaths. So we're gonna inhale through our nose and exhale through our mouth. We're gonna be here for 5 breaths. 4, 3, 2, 1. And now we're gonna come back to center and we're gonna bring our arms to the side. We're gonna do some arm rotations. So we're just gonna go nice and slow. Right here, you can close your eyes again. Focus on your arm movements. Remember to breathe. We're gonna be here for 5 more breaths. 4, 3, 2, and 1. Now we're going to pause and we're going to go the other way. 4, 3, 2, 1. And we're gonna come back to center. You can have both hands on your thighs and you're gonna bring your shoulders up to your ears and you're going to roll those shoulders forward. Really exaggerate those shoulder rolls. Breathe. be here for a few breaths. 3, 2, 1. And we're going to pause and we're going to roll our shoulders the other way. Remember to exaggerate those shoulder rolls. Really focus on that breath. Remember, you can close your eyes if you want to. Three, 2, and 1. And now we're going to bring our hands on our knees again. We're just going to take a deep breath and we're going to inhale looking up. And we're going to exhale looking down. Inhale back up. You want to feel your neck muscles stretch while you're looking up towards the ceiling. And down. You're going to do this at your own pace. Two, and 1. Last one here. You're going to bring your head back to center. Now you're going to choose the right side. We're going to turn our head to the right side. And then we're going to bring our head back to center. And then we'll bring your head back to the left. And you're going to come back to center, to the right. And you're going to do this at your own pace. You want to take your time with these. If you reach a point where your neck feels uncomfortable or you feel any pain, just go to the point where it is most comfortable. We're going to be here for a couple breaths. We're going to come back to center. We're going to have our arms in front of us, and we're going to just rotate our wrists. Remember to breathe. Exaggerate those wrist rotations. We're going to do 3 more. 2, and 1. We're going to pause and we're going to rotate the other way. Three more. 2, and 1. Great work. We're going to have our hands back on our knees. And we're going to take a deep inhale in. And we're going to bring our shoulders up with us, okay? So we're going to take a deep breath in. We're gonna reach up tall. We're gonna hold it. And we're going to exhale. And extend our arms, hands touching our knees. Inhale. And exhale. You're going to do this at your own pace. Great work. Keep breathing. Three more. Two. And one. And we're just gonna have our hands on our knees. We're gonna look forward. We're just gonna take a few deep breaths here. Now where we are, you're just going to have your eyes closed. You're just going to keep focusing on your breath. And you're going to leave all the external stressors outside of your mind. Right now we're in a place where you are most comfortable. We're going to be focusing on you and your needs. If it helps, you can think of a place where you would like to be, especially during COVID. With your family, friends, on vacation. Just think about that happy time and use that positive energy into today's class today. And 2 more breaths. Two. And one. Great. Now we're gonna stand. We can just stand in front of our chair or even beside our chair. I'm gonna put my chair to the side just so that I have more room. And we're gonna be doing a full body twist. So just looking like a star, we're gonna extend our legs out to the side, arms to the side, and we're just going to twist to one side. Back to center. Now the other side. Back to center. You're gonna do this at your own pace. Remember, you can close your eyes whenever you want to. I want you to feel that energy through your feet, through your legs, through your torso, through your spine. We're going to do 3 more on both sides. Two. And 1, both sides. And back to center. Now you're gonna have your chair on the side. You're just gonna keep it on the side today. We're just gonna do some side lunges. So we're gonna open up our toes, make sure our toes are facing outwards, holding back on the seat of the chair. And you're just going to bend to one side. Make sure you bend. You can even look the way that you're bending. That's okay too. Come back up. You're gonna bend to the other side. Make sure your knees don't go past your toes. You're going to do this at your own pace. If you want to have a deeper stretch, you can spread those toes a little wider from where you are now. Focus on your breathing. We're going to do 3 more on each side. Two. And 1. Great. Now we're gonna have 1 foot forward, 1 foot back. We're gonna go up on our toes on that back foot. We're just going to lunge forward, just like this, and you're gonna go back up. Remember to keep that back foot on your toes, down and up. We're gonna be here for a few breaths. Three more breaths. 2. And 1. Now we're going to switch feet, back toe, back foot on your toes, and we're going to bend and up. Focus on your breath. Three more. 2. And 1. Awesome. Now we're going to face forward. Now we're just going to bring that outside foot up a couple inches from the floor. Have the other hand hold onto the chair. And we're just gonna hold here for 8 seconds. 7, 6, 5, 4, 3, 2, and 1. Now standing where you are, where that foot is, you're just gonna bring that foot to the side, and you're gonna bring it back to center, to the side, to the center, and you're gonna do this at your own pace. If you'd like, you can have a hand on your hip if that helps you with your balance. We're gonna be here for a couple of breaths. 2 more breaths. And 1. Awesome. Now with that outside foot, you're gonna put that foot over your inside foot. And you're gonna bring your arm, you're gonna inhale. And you're going to exhale and fold to one side. We're really gonna stretch this side of your body. And then we're going to inhale, back up. And exhale. You're gonna do this at your own pace. We'll be here for a couple of breaths. Two. And 1. And now we're going to face the chair the other way. We have to do the same thing to the other side as well. So remember, outside foot, we're going to hold it up. We're going to hold it for 8 seconds. 7, 6, 5, 4, 3, 2, and 1. With that same foot that is lifted, we're gonna open to the side and bring it back to center. You're gonna do this at your own pace. Remember to breathe. Let's do 3 more. 2. And 1. Awesome, now keep that foot up. And now we're just gonna point the toes up and down. Now we're gonna stand. Remember to have that outside foot over our inside foot. And we're gonna inhale. And we're gonna exhale and fold to where their other hand is. Inhale. And exhale, folding over. You're gonna do this at your own pace. We're going to do 3 more. 2. And 1. Now we're going to do the warrior pose. So if you've done yoga before, this may be very familiar to you. You're going to face the back of your chair. 1 foot forward, 1 foot back. Make sure the back leg is pointed outwards, 45 degrees. And we're just going to bend that front leg, just like this. And we're just going to hold it for 5 seconds. 4, 3, 2, and 1. Now we're going to place that right hand, or whichever hand is closest to the front foot. And the opposite hand, you're going to pretend like you're holding a bow and arrow. So you're just going to pull back, inhale back, And then release, and like we're scooping soup. And we're gonna inhale and release and scoop that soup into the bowl. Inhale, release. And you're gonna do this at your own pace. Make sure you're breathing. We're gonna do 2 more. And then we're gonna switch to the other side. 1 more. And 1. And now we're gonna switch. Same thing, back foot, 45 degrees, bend that front foot. And we're going to inhale, bring that arm out, release, and scoop that soup up. Inhale, bring it back, release. And you're gonna do this at your own pace. We're going to do 2 more. Two. And 1. Awesome. Now with that chair, the back chair facing towards you, you're gonna make sure the front of the chair is facing you now. So we're gonna move the chair to the front here. And if you've ever done the cat and cow, you'll be very glad to know this, that you can do it on the chair too. So if you have issues going on your hands and knees, especially on the ground, you can just use a chair or a small table that you have. And make sure you're 90-90, arms and legs. And you're gonna inhale. You're going to look forward. Breathe, look in front of you, and you're gonna exhale. When you exhale, you're going to curl your back. Make sure your shoulders are curled as well. And pretend that your nose is trying to touch your belly button, and you're going to inhale. And you're going to exhale. So you're going to do this at your own pace. Focus on your breath. We're gonna be here for a couple breaths. Two more. One more. Awesome. We're gonna bring back to center. And now we're gonna have the chair facing forward. So for me, I'm facing towards the audience. And I'm just going to sit on the chair. We're gonna do some chair squats. So we're just going to, you can either place your hands on your thighs or you can place your hands on the side of the seat. And you're just gonna push off. Inhale up. And then you're gonna go back down slowly and steady. And if you're going on your thighs, use your thighs to guide you up and down. We're gonna be here for a couple breaths. Let's do 2 more. One more. just going to stay seated this time. So now let's just inhale our arms. When we inhale, we're going to bring our arms up, inhale up. And when we exhale, we're gonna have one arm in front of us and one arm to the side. So we're gonna make the letter L when we exhale. And we're gonna inhale up. And we're gonna do the other side. Inhale up. And exhale down to the other side. You're going to do this at your own pace. We're going to do 2 more. One more. Amazing. Now we're going to come back to center. Now we're just gonna have our hands on our thighs, upper thighs, and we're just gonna do around the world. So we're just going to go clockwise one way. Remember to breathe. Two more breaths. And one more. And we're going to pause and we'll go the other way. And 2 more breaths. And 1. And we're going to pause back to center. And now we're going to do some seated marching. So alternating leg and foot, we're going to lift one leg and one arm up, and then the other one. I want you to make sure your marching is controlled. We're not hitting the ground too hard with our feet. We're just going nice and slow. Remember to breathe. We're going to do 2 more. And 1. And back to center. We're going to sit a little back on our chair. And we're just going to do single leg extension. So we're just going to flex that right foot up. Extend that right foot up. And we're going to bend that knee back down. Right foot back up. And bend that knee down. You're going to do this at your own pace. Two more. And 1. And now the other leg up. Remember to breathe. Two more. And 1. And back to center, we're gonna bring one leg up. So let's bring that one knee up. We're gonna have our hands placed underneath our thigh. And we're just going to pull that thigh close to us. So we're just gonna do a stretch here. We're gonna take 2 breaths. And 1. And we're gonna do some ankle rotations here to one side. 3, 2, 1. And now the other way. 3, 2, 1. And you're gonna slowly release that leg down. You're gonna grab the underneath of the other thigh. You're gonna squeeze that thigh up to you. Hold it for 2 breaths. And we're going to rotate that ankle one way. 3, 2, 1. Now the other way. 2, and 1. We're going to slowly bring that thigh back down and back to center. And now we're going to have our hands on our shoulders. Your fingers are going to look like spider legs, so they're just going to be up on your shoulders. And you're going to inhale. And you're going to push that chest out. We want to stretch that chest out. Bring those elbows back. Hold here. And we're going to exhale, bring those elbows forward. Elbows slowly touching in front of us. And then inhale. Pop that chest out. Make sure our shoulders are back. Elbows, bring those elbows back a little bit. And exhale, elbows front and touching. You're going to do this at your own pace. Remember to breathe. We'll do 2 more. And 1 more. Awesome, back to center, hands as those spider legs back on our shoulders. We're gonna bring our elbows in front of us. And now when we inhale, we're just gonna pike up those elbows up, up to the sky as high as we can. If you cannot reach that high, that is okay. Just reach to where it is most comfortable. And you're going to exhale down, all the way down. And inhale up. And exhale down. You'll do this at your own pace. We'll do 2 more. One more. Amazing. Now back to center. We're going to inhale. We're going to bring our arms up when we inhale. Up to the ceiling, and we're going to exhale. Bring those arms forward, and we're going to do a forward fold. And we're going to bring ourselves back up. And exhale down, forward fold. We'll do a couple here. We'll do 2 more. And 1. Bring yourself up slowly back to center. Now for this one, we're just going to sit up at the edge of our seat. We're going to do a goddess pose. So let's spread our toes, spread our knees, just like this. We're going to have our arms 90-90 to the side. Bring the shoulders back a little bit. And we're going to inhale, raising those arms up. And exhale down, back to 90-90. Inhale up. Exhale, back to 90-90. We'll be here for a few breaths. Three more breaths. And 1. Now staying where we are, 90-90. We're going to twist one way, so just our upper body is going to twist. And we're going to twist back to center. And to the other side. And back to center. To the other side. Remember to breathe. You're going to do this at your own pace. Let's do 2 more. And 1 more. Great. Now we're going to go back to center, hands on our knees. And now we're going to do our eagle arm. So we're going to have right arm 90-90 in front of us. And we're going to put the other arm over top. Just like this. So back of the hands facing each other. And we're going to lift up. We're going to hold it for 3 seconds. If this is too difficult for you, you can also just palms touch, elbows touch, and you can just raise up, okay? So let's try that. Reaching up. We're going to be here for 3 breaths. 2. And 1. Bring the elbows down. Now we're going to switch arms. We're going to bring the elbows up. 3 seconds. 2. And 1. Now releasing your arms very slowly back to center. We'll have one arm in front of us and the other arm on the upper part of our thigh. We're going to inhale. And we're going to forward fold, exhaling. Just reach in front of you as far as you can. Inhale, back up. Sitting up. And exhale back down. And exhale down. You'll do this at your own pace. Make sure you're not arching your back. Use those abs to bring yourself up. Two more. One more. Back to center. Now we're going to switch arms. Inhale. And exhale down. We'll do two more. And one more. And inhaling back up to center. Now we're just going to sit on the edge of our seat again. We're just going to spread our toes, spread our knees, and you can have your hands on the side of you or on the upper part of your thigh. And you're just going to lift one foot on the heel. And you're going to bring that down. You're going to bring the other heel up on the other foot. Bring it down. And we're going to alternate. Focus on your breath. You want to work those calf muscles. We'll do two more on each side. And one. Now where we are, we're going to have our knees back to center, arms back to center. And having that right foot, we're going to use our toes and we're going to reach in front of us, just a few centimeters in front of us, have our toes touch. And then flex that knee, bring those toes back, have them touch a couple centimeters back, front and back. We'll be doing a few reps of these. Make sure these are controlled movements. If it is better for you, you can have your hands on the side of the chair for more support. Let's do two more. And one. But back to center, we'll do the other leg now. So that toe in front of you, couple centimeters above. And bring the toes back behind you. We'll do 2 more here. And 1 more. Awesome, now back to center. We're gonna do an angel wing. So we're gonna have 1 forearm across your knees. You're just gonna have the other arm. You're gonna bring yourself down into a forward fold. Now you're going to inhale, and when you do so, you're going to bring that arm to the side. Look at where your hand is. And you're going to exhale back down. Same thing back up. And back down. Do this at your own pace. And when we inhale and bring this arm up, we're going to hold it however high that you can. We're going to hold it for 3, 2, and 1. Exhale, bring it back down. Now you're going to switch sides, okay? So back, bring yourself back up. Alternate the forearm, bring yourself down. Inhale, bring that wing up. Look at the hand. And exhale down. Inhale up. Exhale down. Do this at your own pace. Now next inhale, you're gonna hold that wing up. Hold it here for 3, 2, and 1. And you're going to exhale down. And you're slowly going to bring yourself up back to seated position. Awesome. Now we're going to take a few breaths here. Close your eyes if you need to. Two more breaths. And 1. And we're going to spread our knees and spread our feet again. We're going to lift our arms to the side. One palm facing up, the other one down. You're going to inhale, that palm facing up. You're going to bring it up. You're going to look to that open palm. And you're going to breathe down. Bring that palm down. Bring it back up, inhale. And exhale. And inhale. You're going to do 2 more at your own pace. Now looking the other way. And the other hand's gonna flip, palm facing up. You're gonna inhale, bring that palm up. Look to the upper palm. And exhale, bring yourself back down. Flip that palm down. You're gonna do these At your own pace. Exhale down. Two more. One more. And now you're going to be back to center, knees facing forward. And we're just going to take 2 deep breaths. Now, where you are at the center position, you're going to bring the one hand over the other hand. And you're just going to look down. And you're going to breathe. We're going to be here for a few breaths. Three, two, and one. Bring your head back to center. And we're going to put our hands on the other knee. We're going to look down. Remember to breathe. Three, two, and one. Now we're going to bring our head up, hands on our knees. We're going to extend one leg, toes facing up, and we're just going to do a hamstring stretch. So you're just going to have one hand on the other knee and the other hand on the extended leg. You're just going to fold towards that leg. You can use the other arm on your knee as support. Then we're just going to stay here for 5 seconds. 4, 3, 2, and 1. Bring yourself back up. And we're going to switch the other leg. Extend that leg, toes facing up. Slide that hand down for 5 breaths. 4, 3, 2, and 1. Now we're going to come back to center. We're going to have one arm extended. Our head is going to tilt the other way, away from our extended hand. We're going to feel that nice stretch on our neck, even along our arm. If you want, for a deeper stretch, you can place that opposite hand over your head. Just pull it down really gently. We're going to stay here for 5 breaths. 4, 3, 2, and 1. Release that hand off your head. Bring the head back, arm back to center, and we're going to do the other side. Extend that arm, tilt that head away. And of course, if you want, place the other hand on that head just for a deeper stretch. We'll be here for 5 seconds. 4, 3, 2, and 1. Release that hand away from your head. Release that extended arm, hands back to your knees. And we're going to extend our hands right in front of us. We're going to open our palms up. We're going to make a fist with our hand. Curl that wrist towards you. You're going to curl your bicep towards you. Inhale, and you're going to exhale. Bring that forearm down. Extend that wrist. Open that fist. And you're going to do this at your own pace. Focus on the movement, focus on that breath. Let's do 2 more. One more. And now we're going to do a wrist stretch. So you're going to extend one arm up. You're gonna have the palm facing outwards, have the other hand, and you're just gonna push the other fingers towards you. You don't have to pull too hard. Just pull to where you feel enough tension for yourself. If extending your arm is too hard, you can also just bend that elbow just to release that pressure off you. We're gonna be here for 4, 3, 2, 1. Release that hand away from your fingers. Shake your fingers, and then you're gonna do the other hand. We're gonna pull those fingers towards us for 4, 3, 2, and 1. And now we're going to release the fingers, and we're gonna bring ourselves back to center. And now we're just going to take a few breaths. We're just gonna inhale from here. And exhale. Inhale. And exhale. Inhale. And exhale. Now here at center, we're just gonna inhale, bring those arms up. And you're gonna bring them down. Back up. And back down. Inhale back up. And back down. And when we inhale this time, we're gonna have our palms touch. And when we exhale, we're gonna bring our hand back to our head, back to our chest, back to our heart, and back to center. And we're just gonna take a few breaths here. You can close your eyes if you'd like to. We're just gonna stay here for a few breaths. Two more breaths. One last breath. Amazing. And thank you everyone for joining our gentle movement class. And now we're going to proceed with questions that Darcy has. She's going to be reading them out, and then Dr. Sandhu and I will be answering them.
Okay. Thanks so much, Psylocke. That was really a lovely series of movements. That was just great. We don't seem to have any questions right now. If anybody has any questions that they want to type into chat, go ahead. But I actually have a couple questions that I'd like to ask. The first one for you, Psylocke, is this is such a nice routine. I'm just wondering, what's the best way to use a routine like this? Is there a preferred time of day, frequency in a week, and is it more for stretching, relaxation, both, sort of determining where our pain may be in our body, or what can you tell us about that?
I think these type of movements can be expressed through any time. When you're stressed, when you feel a little sore, a little achy, I feel like these exercises and activities are very important to integrate into everyone's life. Even if you do it like once a day, once a week, I think that's pretty good to reset your mind, reset your body, and just to give yourself a break from everyday life.
And
It
just
really,
to add to Salak's comments, we know a lot of people with chronic pain might be signed on today. So, any sort of regular routine you can use, like gentle movement and relaxation and breathing. The breathing and the movement will really help reset that tolerance level to pain.
and I think too, from a more of an emotional, spiritual point of view, it keeps us grounded, doesn't it, in the present moment? And we get so busy, and especially during the pandemic, we're so easily distracted. So I'm just so relaxed right now, and and sitting at a computer. It's just so great to keep moving around like that. That's been really nice. Dr. Sandhu, I have a question for you about cold laser therapy. Can you just tell our listeners just a little bit about it and what types of injuries or pain areas it can be used for?
Mm-hmm. So there's lots of research behind cold laser. It's been around for about 50 years. We use class 3B lasers, which are Health Canada approved. The guys at Harvard are using these type of lasers at the Wellness Center for Photomedicine at Harvard. And the most common conditions that we actually see are for osteoarthritis and internal scar tissue. So those are the two most common conditions that we treat in our clinic.
I know when I dislocated my shoulder, it was so great for acute injury, but it's never too late, is it? So if somebody has had arthritis for a long time, they can still benefit, can't they, from cold laser therapy?
Absolutely. Mild, moderate osteoarthritis, the cartilage actually regenerates. So there's been studies that show they compared, both knees, they lasered one side, and the side that they lasered, they actually, the cartilage regenerated and the patient was healthy. The other knee, they had to get replaced. So if you let it get too far along, then if it's more severe, then you're going to be a surgical candidate. But if it's mild, moderate, then we've had patients walk in with canes, limping in here, and then walk out without canes.
Wow, that's just great. And did I read something about red light cold laser therapy for hair regrowth? Is that a thing?
There's not a lot of research behind hair regrowth, so
Okay.
we don't use it here. So
Okay.
we try to base our practice on evidence base. So
Right.
there's, even for concussions, putting it right over the brain, we don't do that here because it's not an approved therapy.
Okay.
But we'll treat the neck because there's a lot
Yeah.
of concussions are associated with neck pain and trauma to the cervical spine. Sidney Crosby was, a hockey player that there was a chiropractor that finally got rid of his concussions because they looked at his neck.
Interesting. Good to know. Okay, well, we don't seem to have any other questions tonight. So we've got a nice comment from Chris Tung saying, thank you very much. A very good stretch. And this is the best part about having these seminars on YouTube because it's here for us. So we can come back anytime we want to. I know I'm going to definitely come back and do Silak's routine again. Your pacing was really good, Silak. I really enjoyed it. I might just add
She was absolutely.
Yes, so good. I might just add some of my own music at my own end, but that's it's so nice to follow somebody. It's just to follow somebody along, right? And I thought that was really great.
She was absolutely fabulous. And if our listeners want to share the link with their family members, absolutely do so.
Yeah.
Anyone suffering with pain or injuries, this would be a great, or even stress. It's great relaxation, as you realize, Darcy.
No kidding. I'm just half asleep here now. It was so great. Anyways, thank you all so much for coming tonight. It's really been great. And thank you, Dr. Sandhu, and thank you, Silak. It's really been great. Also coming up for choices are one more in our cooking series. If you want to learn how to cook lamb on March 30th, so you can go to our website and check on that seminar as well. And over the next few days, don't forget to come back and check out Siloc's routine again. So we'll all be superhuman before we know it. Okay, everyone.